Thanks very much, Neil. Let's just remind you of the big breaking news tonight. The Princess of Wales announcing that she is currently receiving treatment for cancer. Now, Kate tonight released a very personal video message explaining why she has chosen now to make this news public.
I wanted to take this opportunity to say thank you personally for all the wonderful messages of support and for your understanding whilst I've been recovering from surgery. It has been an incredibly tough couple of months for our entire family, but I've had a fantastic medical team who have taken great care of me, for which I'm so grateful. In January, I underwent major abdominal surgery in London, and at the time, it was thought that my condition was non-cancerous. The surgery was successful. However, tests after the operation found cancer had been present. My medical team therefore advised that I should undergo a course of preventative chemotherapy, and I'm now in the early stages of that treatment. This, of course, came as a huge shock, and William and I have been doing everything we can to process and manage this privately for the sake of our young family. As you can imagine, this has taken time. It has taken me time to recover from major surgery in order to start my treatment. But most importantly, it has taken us time to explain everything to George, Charlotte and Louis in a way that's appropriate for them and to reassure them that I'm going to be okay. As I've said to them, I am well and getting stronger every day by focusing on the things that will help me heal in my mind, body and spirits. Having William by my side is a great source of comfort and reassurance too, as is the love, support and kindness that has been shown by so many of you. It means so much to us both. We hope that you'll understand that as a family, we now need some time, space and privacy while I complete my treatment. My work has always brought me a deep sense of joy, and I look forward to being back when I'm able. But for now, I must focus on making a full recovery. At this time, I'm also thinking of all those whose lives have been affected by cancer. For everyone facing this disease, in whatever form, please do not lose faith or hope. You are not alone.
Well, it is a very human story, but it's a royal story that is receiving global attention. More reaction coming in to us all the time here at Sky News. We've just heard from the US Ambassador to the UK, Jane Hartley. She has released a statement this evening saying, "I'm heartbroken to hear of the Princess of Wales cancer diagnosis. On behalf of all of us at the United States Embassy in London, I wish the Princess a swift recovery, and my thoughts are with her and her family." Well, there's also been a message from the Prime Minister of New Zealand, Christopher Luxon. He said this: New Zealand's thoughts are this morning with the Princess of Wales following the news of her cancer diagnosis. I know Kiwis across the world will be wishing her well in her recovery. Well, let's speak now to Dr. Anna Hemming, a former royal family GP. Dr. Hemming, thank you so much for speaking to us here on Sky News this evening. First of all, your reaction to this news?
I was incredibly sad to hear the news that came out at 6 o'clock this evening. And what a shame. It's really, really tough to take in.
Can we talk about the medical details that the Princess of Wales chose to make public today? She said that she had major abdominal surgery. As a consequence of that, subsequent tests revealed that cancer was present, a cancer diagnosis. And she's now undergoing cancer treatment. Can you just talk us through what that is like? Because so many people at home will be just about to start that journey, and cancer presents and cancer is discovered in so many different ways, and often it is by going into hospital, as we saw with the King, that you go in with one thing and something else crops up.
Yes, that's right. And actually, in these cases, it can be quite fortunate that the cancer cells are found early. And when things are found early, then the recovery from the cancer is often extremely successful. I think that when somebody has such a surprise diagnosis, like Her Royal Highness has had, that obviously it takes quite a moment to sink in, because she may not have had any symptoms. And obviously, having had surgery, she's recovering from that at the same time. So when you get this news, it's going to take a while to sink in, and also take a while to be able to commence your treatment from it. Luckily for the Princess of Wales, in this case, it has been found very early, and the treatment that she will be given is going to be understandably one that hopefully she's going to come through very, very well. The treatments that you have at this point for cancer can come in different forms. You can have oral medication, further surgery, treatment that you might have, chemotherapy in hospital, radiotherapy, and for each type of cancer, the treatments are very different, and they can be tailor-made to the individual now too. So there is so much available, and the recovery rates from cancer are improving year on year. So for everybody out there who's going through this, it can be incredibly difficult. But you will have the support of your medical professionals, your family, all of your loved ones around you, and you have to stay positive.
Dr. Hemming, can I ask you about the age of the Princess of Wales? Because so many people tonight are saying she's so young. She's 42 years of age, and I know that when we cover the King's cancer diagnosis, not to be insensitive, he's over 70, so it's something that you might expect. But when it happens to a young mother in her early 40s with 3 young children, talk us through the statistics. How common is this?
It's obviously not as common when you're in your early 40s to have a cancer diagnosis. It's not unheard of. And I think that as obviously our understanding and our scanning and our detective work is improving, we are tending to find in some cases of certain cancers that we're finding it at a much younger age. Now, this is obviously a shock when people are in their early 40s or even younger and they have a cancer diagnosis, but it can also be quite positive because it's found at that point. And some cancers are incredibly slow to progress. So you could be in a situation with no symptoms where you've got cancer and you don't know. So luckily for the Princess of Wales, it has been found. It sounds like it's incredibly early in the state of the cells, and hopefully everything has gone. So that the treatment she will be having will be a preventative treatment to make sure all of those cells within the body are absolutely gone, and therefore she can then recover and continue to be monitored to make sure they don't come back.
Dr. Hemming, cancer is the great leveller. It doesn't matter if you're the royal family from Windsor or the Jones family from Slough. You've been a royal family GP. Obviously, they're just like the rest of us when it comes to health, but also they come with a higher level of public interest, and in that respect, a higher level of expected privacy when it comes to medical matters. Can you just talk to me about how that's navigated? Because that has made headlines this week in terms of people's interest in the royal family's health. Some people trying to find out more than they should by, terrible means. How do you protect them in that sense? People have said it's brave for the King and now the Princess of Wales to speak so openly, but just how protected are they when it comes to medical matters?
I think it's wonderfully brave that both the King and the Princess of Wales have spoken out about what's going on. As we've all heard over the past few weeks, there's been a lot of speculation, a lot of stories run by the press and the media, and actually that can be more harmful and more hurtful to a person than talking about what's really going on. So I think she's incredibly brave to have released the information that she has today, and I really hope that the aftermath of that will be that the Princess of Wales will be left to recover. And I'm so proud that she has navigated through talking to her young children, which is not easy with these kind of conversations. And the support that I hope they all have, and the strength and the unity they have as a close family and the extended family, and obviously the rest of the world that's right behind her. It's so important. It's so important to stay positive.
Dr. Anna Hemming, thank you so much for joining us on Sky News this evening, reacting to that breaking news. The Princess of Wales announcing in a personal video statement earlier on tonight that she is receiving treatment for cancer. Let's now bring in our royal correspondent, Rhiannon Mills, who is standing by. Rhiannon, it's been quite a few weeks